to them. Get up now.
We're going to be doing a two-part self-massage series here through YouTube videos. So what we're going to do is break it up into two categories: upper body, basically waist and above, and lower body, waist and below. So we're going to use some different tools. I'll explain the tool when I bring it up, and I'm going to basically show you what I think is my best method or favorite method to do some soft tissue work on these areas. And then we're also going to have some alternate options in case you don't have that tool available to you. A lot of things you're going to be using the foam roller, massage sticks, lacrosse balls, things of that sort. So we're going to start top to bottom. We're going to have the neck first. So my favorite soft tissue tool to use the neck is just 2 tennis balls and masking tape. They'll sell tools that basically mimic this, but all you need is 2 balls and masking tape. That's all I have here. So what we're going to do is basically place this right below our occipital bones, or the big bumps on the back of the skull. So you're going to lay down. I'm going to have these just below here. And first step is just relaxing and breathing. We're just trying to decompress the neck a little bit. And then what you can do to just have an added component is a little bit of flexion extension. So I'm basically going to look up to the ceiling and then tuck my chin down, make a double chin to gain a little bit of movement there. So if for some reason you don't want to use this, so Rolga foam roller is something I'm going to reference a lot. I'll show you some stuff with a standard foam roller too, but this is something that you can use. It just elevates you a little bit more than I would like, but it is good to kind of target the same area. So basically you're going to use these 2 bumps in the same position as those tennis balls would be in, and same exact technique. I can do a little bit of that extension and flexion, or you can just relax there, trying to relax the muscles on the back side of the neck. So next we're going to get into the upper back. So for the upper back, you can use the Rolga roller, or you can use a standard foam roller. Either one's going to work fine. I just prefer the Rolga roller for the reasoning that it has these grooves that the bones can sit into, so that it's not just 90-degree pressure straight into the bone. The bone sits into here, and we can get the musculature around the bone a little bit more. Especially for the spine, I much prefer the Rolga. So basically what you're going to do here is roll the mid to upper back. So I'm going to set up the Rolga here. I'm going to just basically give myself a hug, love yourself, and then we're going to roll from the mid back to the upper back. So we're just going to do some passes here. Hips down on the ground if it's too intense. If you want to increase the intensity, I'm lifting the hips up almost into a bridge position to put more pressure onto the roller. So set up with this, you can use the standard roller, that's just fine. And just another way to add movement to intensify would be to kind of grasp the back side of the head, and you're going to bring your elbows together. And then all I'm going to think about is basically the roller as a pivot point. So everything above the roller, I'm going to try to extend and flex. And I'm going to try to avoid this movement coming from my lower back. Excessive movement is probably going to be you compensating from down low. We're trying to keep this isolated up top. So extend and then flex, and then basically move down a segment, and same thing. So we can pin some different spots in the back and just move through that way. So now we're going to move into the lower back. There are 2 different things we can do for this. If you have one of the Rolga rollers, you can roll your lower back. If you have a regular roller, I don't advise direct pressure onto the lumbar vertebrae. Probably not going to be the best idea. But if you have this, you can actually roll the low back a little bit. So basically, you can just set up here and target those erectors a bit without having to, possibly damage the spine. One sec. And another technique that you can use is using a yoga ball. So what this is just basically a soft ball. It's not filled up all the way, and it's good for targeting some more sensitive areas. So if we put this on the lower back and just extend back from here, using our relaxed breathing techniques and just kind of sinking down into it, it's a good strategy for the lower back. And we can also use on the QL, which basically attaches our ribs to our pelvis, so I can get onto the side a little bit more and bias a little bit more to that QL, which can help with a lot of low back discomfort. So this is just called the Courageous ball. It's just something I grabbed off Amazon. Moving on, we're going to get into the traps. So for the traps, we're going to use some different tools. Either a massage stick, one of 2 options for a massage stick. What I've got here, this is a dense, firm piece of metal. It does not bend. And then we have this one called the stick. It's got a lot of flex and bend to it. It's really just a tolerance thing. Sometimes getting more pressure and having the flex will be good for you. Some people might prefer just getting at it with the stick here. So for the stick, basically what you can do is set up in some sort of structure where you can pin one end of this and get up underneath it and roll through your traps. Being me just doing this with my hands isn't going to give me enough pressure. So if you don't have access to that, and getting up under a rack or a windowsill, something like that you can wedge this into, then I would suggest using a ball on a wall. Setup can be a little bit awkward, but it's still beneficial. So basically I'm just going to set the ball onto the wall here, and I'm just rolling from the base of my neck up to the top of my shoulder to affect the traps and some of the other shoulder stability muscles. Next, we're going to get into the lats and the intercostals. So for the lats, you can use this yoga ball as well. I like using this. It's going to help you to just kind of target a sensitive area. So I can just think about breathing and feeling pressure into the ball. And exhale and then sink dead weight onto the ball. So this is a good way to attack it if it's especially sensitive. I like this. And you can also use the roller. So either roller is going to be fine. I'll show you with the Roga. Basically, I'm going to reach one arm up overhead, and I'm going to roll from the base of my armpit halfway down the rib cage. So I can play with a little bit of rotation, getting a little bit more backside, getting a little bit more lateral. A lot of times this is very intense for people. So what you can do is try it on a wall. So basically set up, same concept. I'm just basically squatting down and up to attack that. And you can also do a pin and move strategy. So when we talk about pin and move, what we're doing is basically using the item that we're looking for, roller, stick, whatever, to pin the tissue down and create some sort of movement there. So I can pin my lats down, exhale, and reach my arm up overhead to try to get a release there. So those are all good strategies. You can do the pin and release down on the ground as well. Next, we're going to get into the pecs. Well, we're talking about the attachment for the pecs, the sternum right in the middle of the chest. Very sensitive area. You're not going to want to hit that with a roller or anything. So a yoga ball can be a good way to affect the attachments. And all you would do is basically set this right into the middle of your sternum. Support your forehead. And just using relaxed breathing. Just trying to sink down onto the ball. We can also use a foam roller. This is one that probably a regular roller is better for than the Roga. Basically, I would reach one arm up to the side, and I'm just going to roll across in a diagonal fashion from my armpit to the middle of my chest. Can be a little uncomfortable if you got a lot of tension there. Another technique that you can use is with the ball on the wall as well. So basically, I'm just going to pin the wall here, and I'm going to ride underneath my clavicle and just ride side to side here. So that's another good strategy as well. Next, we'll move into the rhomboids. So for the rhomboids, basically we're talking about the rhomboids or any musculatures on the inside of the shoulder blade. So I'm going between shoulder blade and spine here. So a ball in the wall is probably the best technique to get at these. You can just basically find a good spot, roll a little bit side to side, play with different heights, and see where you kind of feel it the most, and then bias your attention towards that. We can do a little bit of pin and movement too. I can reach up overhead. I can reach across my body. I can reach my shoulder blade forward and back. A lot of different movements you can do there. So if you don't have a ball for whatever reason, the roller, basically what you would do is our upper back foam rolling with a little bit of bias side to side. So I'm going to basically give myself a hug that same way, and I'm just going to bias more to one side and try to really get in between that shoulder blade and the spine to affect that musculature. Next, we're going to talk about the rotator cuff and the posterior aspect of the shoulder. So the ball is going to be your best tool. I would say whether we do it on the ground or whether we do it on the wall is mainly dependent on your tolerance to it. So this is one I really like using a pin and move strategy for. So we're going to go right to the back side of the shoulder. I'm going to hit the ball up under there. And then I'm just going to go through some rotation of my shoulder. So I'm going to rotate externally and rotate internally with the ball in that position. And you can play around with it a little bit and find where it speaks to you the most. So there's no one specific perfect spot that you need to hit with this. Find where you feel like it needs the attention and give it there. So if that feels like it's too intense and it's just really uncomfortable, basically go to a wall same exact movement though. So I'm just gonna find the back side of my shoulder, pin it into here, find a good spot, and then rotate the shoulder in and out from there. So for the deltoids, we're talking mid-delt primarily. You can use the roller or the ball on the wall. So you can basically get a roller here, and I can pin here and put pressure into the wall and roll up and down a little bit, or I can use the ball in the same fashion. I'm just pinning right between here into the wall, a little bit of up and down, a little bit of side to side. Again, find what speaks to you the most. Next, we're going to talk about just basically the rest of the arm. So we're going to go bicep, tricep, and forearm. So for the bicep, it's a sensitive area. We've got a lot of nerves that pass through here. It's not something I want to really beat the crap out of. So what I would suggest is that you use a stick and just use light pressure. So basically, I'm not going to really hammer down into this. Just gently kind of roll forward and back. Using one hand is going to be fine for this area. Or you can just use your palm and do a pin and stretch technique. So basically, I'm going to take my palm and kind of pin my bicep down and then extend my elbow. And you should feel a stretch coming through that bicep. Not so much pinning down that you feel burning or anything like that. You should just feel a stretch through the front side. When we get into the triceps, again, the stick is going to be a good tool. So basically, you're going to want to take the stick. If you can wedge it down between something, I can use my own knee here and just roll the back side of the arm. You can use a box, you can use the floor, whatever you have access to be able to just pin down and get to the back side. If you don't have access to the stick, but you have a ball at home, what I suggest is basically using a table, a box, a bench, whatever you can, and then pinning different spots and then doing a pin and stretch technique similar to the biceps. So I'm going to pin down my triceps as if I was on a table, and then I'm just going to extend and flex the elbow from there. And you can play with different positions there as well. When we get into the forearms, again, it's one that I think the stick is going to be good for. So using that wedge on the ground is going to be great. You can just roll on the inside of the forearm. You can attack the outside of the forearm, and all I need to do is wedge the stick into the ground. If it feels like you keep losing it, then just slip it into a corner of the wall, and that way it'll be a little bit more stable. And for the forearm, you can also use the roller. I do prefer the stick, but you can set your forearm on the outside grooves of the roga and play with different hand positions to target different areas of the forearms. So this is all the upper body soft tissue drills that we're doing. There are other definitely methods that you can use, but these are some of my favorites that I've tried to cover all of the aspects of the upper body. In the next video, we're going to cover the lower body and how to attack those.